So finally after the cytological and the radiological diagnosis comes in, then we know what kind of a breast lump we are dealing with. If it's a benign breast lump or a non-malignant breast lump, then we are very happy, and the treatment protocols would usually advocate a simple surgical procedure like a lumpectomy. Sometimes if the benign lumps are very small, probably as small as 1.5 centimeters, we can still wait and watch. We don't have to rush the patient into surgery. You can always keep them at a close follow-up. But suppose if you get a patient who's been diagnosed with a breast cancer, then the treatment protocols is very different. And what is very important is, once we have diagnosed that the patient has breast cancer, the next step would be to stage the disease, which is very important to know whether the disease is only in the breast or whether the disease has spread to any other part of the body like the liver or the lungs or the bones. So we subject the patient to a thorough body checkup, which would probably involve an X-ray chest or a CT scan of the chest and an ultrasound of the abdomen and also a bone scan. And once the disease has not spread, then depending on the size of the lump, so this is the anatomy of the breast, and this is the nipple areola complex, and this is the fat and the glandular tissue of the breast. And the lumps can arise anywhere in the breast. It can also arise below the nipple areola complex. Now if you go into the anatomy of the breast, you will find that the breast comprises of these ducts like this, which are called as the milk ducts or the lactiferous ducts, and this is basically the fat lobules in the breast. So you can get a breast cancer either in these ducts like this grayish thing which you see just along the duct. You may get a cancer in the duct, which is called as a ductal carcinoma, or you can also get lumps like this in the fat of the breast, which is called as lobular carcinomas. So this is the way the lumps would basically look, and these lumps would be growing inside the breast, and only when they are about 1 centimeter in size would you actually be able to feel them here on the surface of the breast. So once the stage of the cancer is identified after all the tests have been done, if the patient is in the early stage, that is in stage 1 and early stage 2, where the size of the tumor is less than 5 centimeters, then we can opt for conservative breast surgical options. That is, we opt for breast surgery without removing the breast, unlike old times where if a woman was identified to have breast cancer, then removal of the breast or mastectomy was the treatment of choice. But now, with more advances in conservative breast surgery and certain reconstructive plastic surgery techniques called oncoplasty breast surgery, we have now come up with different surgical procedures which involve treating the breast cancer without removing the breast, and also reconstructing the breast to give it a good cosmetic appearance.